Hi, this is Dr. Wooler for Integrative Medicine Academy. The title of this video is High Manganese on a Hair Analysis, Potential Link to Brain and Nervous System Toxicity. So a hair analysis, sometimes called a hair metals test, we know can evaluate for heavy metal exposure, so aluminum, lead, cadmium, mercury, but it also evaluates for various minerals. And certain minerals, when they are elevated over a long period of time, can have their own toxic properties. And so manganese is an example. So if we just think about the traditional heavy metals, so cadmium, lead, arsenic, aluminum, for example, mercury, we know that they don't have any essential biochemical role. So, and they can induce a variety of toxicities from oxidative stress. They can block things that are called aquaporins. These are the sections of our cell membrane that allow water to pass through. They can interfere with zinc and calcium and magnesium metabolism. The very young and the elderly at most at risk, but anybody is at risk if the levels are high enough and their exposure is over a long period of time. So we can have low IQ. Some of them can be carcinogenic. They can affect the cardiovascular system as well as the neurological system. Now, heavy metals are generally defined as metals with relatively high densities or compactness. So this is how things are looked at in the world of material science. Physics looks at metals from the standpoint of their atomic number or atomic weight. Now, chemists often look at heavy metals and they focus more on the chemical behavior, which is basically what we're doing as practitioners as well. And so the main human toxic metals are aluminum, arsenic, cadmium, lead, mercury, and thallium. You could probably throw nickel in there. It can cause allergic reactions and a few others as well. So really only trace amounts of these types of minerals are actually needed for biological purposes. So arsenic, I just mentioned, doesn't really have a known role in our body. It does seem to support metabolism a little bit more so perhaps in certain animal studies. In humans, it's questionable. Chromium linked to glucose utilization. We know that cobalt is necessary for B12, copper for electron transport, but of course, elevated levels of those could be problematic, like Wilson's disease or Alzheimer's disease could be linked to too much copper. Iron is important for oxygen transport. Molybdenum is necessary for redox reactions and sulfur transferases. Selenium is an antioxidant and hormone regulator. And manganese is an enzyme regulator, but too much of it can actually be linked to Parkinsonian type of diseases. In many of these metals, okay, whether it's aluminum, arsenic, cadmium, chromium, for example, will tend to disrupt protein structures in the brain and nervous system, receptors, cell function, and many of them actually bind very strongly to sulfur-containing what are called thiols that compromise, again, neurological function, other cellular function. We know that thiol chemistry is also important in phase 2 liver detoxification. So dopamine is obviously critically important in the brain and nervous system. It highly is concentrated in various areas that are related to motor function. So damage within many of these brain structures that are, whether they're high dopaminergic regions or they interact with other brain areas like what's called the nucleus accumbens or the substantia nigra. Substantia nigra is an area that's often compromised in Parkinson's disease. Now, dopamine, essentially as a neurotransmitter, is a very reactive molecule. It gets mostly stored in what are called terminal vesicles of our nerve cells. About 90% of dopamine is stored in these terminal vesicles, which means about 10% sits out in the cytosolic fluid, and our cell tries to sequester it away, but just small percentage shifts in cytosolic dopamine can be toxic. So it can lead to glutathione depletion, oxidative stress, etc. within the nerve cell. And so dopamine actually converts into something called dopamine oquinone, and dopamine oquinone can actually trigger apoptosis of a neuron, so a nerve cell basically committing suicide. It can generate a lot of free radicals. We should have enough glutathione to sort of grab onto that dopamine oquinone and render it less toxic, but ever accumulating amounts of dopamine can deplete glutathione, which would then increase free radical formation and then lead to neurodegeneration. One of the systems in our cells that seems to get affected by high amounts of dopamine oquinone is something called the Ubiquitin Proteosome system. So ubiquitin is a ubiquitous protein. And what it does is it tags other proteins in our cells that it tags it for destruction. So this particular chemical will go and tag a malformed protein or an old protein or misfolded protein, for example, and then the proteasome goes in and destroys it. So the ubiquitin proteasome system is really important for getting rid of old damaged proteins. And dopamine oquinone will affect that system. Prion diseases, for example, which are accumulations of misfolded proteins, can often be taken care of by the ubiquitin proteasome system. So it's possible that a accumulation of dopamine oquinone because of excess dopamine could lead to, again, or contribute, in essence, to prion diseases. So the ubiquitin proteasome system is an area that, again, breaks down these old proteins, and if we don't break them down, this can lead to things like ALS, Parkinson's disease, Huntington's disease, Alzheimer's disease, and even the spongiform encephalopathy. So that would be a prion disease example. And so manganese toxicity, one of the areas it seems to affect is dopamine metabolism. Now, some of the manifestations of manganese toxicity can be anxiety, disorientation, hypotonia, tremor, memory loss, Parkinsons-like syndrome, abnormal gait, violent or aberrant behavior. So it's always important just to keep that in mind. If you have a patient that's exhibiting some of these issues, is consider doing a hair analysis and see if their manganese is elevated. Now, contaminated water, or things like tea, for example, that are contaminated with manganese. Certainly environmental exposures, gasoline, they actually use manganese as an anti-knock agent in gasoline, so your engine isn't knocking. It can be found in pigments and inks. You use it in steel, for example, so occupational exposures, smoking, street drugs, excessive alcohol consumption can all be other sources. Battery exposure, they use it in batteries, for example, some pesticides as well. So we have a course called Toxicity Mastery Course through our Integrative Medicine Academy that goes through all of these aspects of heavy metals, certain toxic minerals when they're elevated, for example. We get into chemical testing and exposure, glyphosate, mold, mycotoxins, detoxification, chelation therapy discussions, protocols, etc. That information and more can be found within our Toxicity Mastery course. So for more information about the Toxicity Mastery course, go to toxicitymasterycourse.com. You can also email toxicitymasterycourse@gmail.com. If you are a healthcare practitioner and would like to interact with us directly, that would be myself, Dr. Wohler, or my partner, Dr. Trincatella. You could do so through a membership site called Functional Medicine Clinical Rounds, where you can actually schedule one-on-one lab consults with us directly. We do have educational material within this website, videos. There's also a question and answer forum. So you can post questions into the forum. We have a series of videos, and as I mentioned, you can also book consults with us as well for lab reviews, clinical case presentation, troubleshooting, etc. One of the other things we have is the clinical data sheets. These are one-page PDFs that profile different lab tests or sections of lab tests and different markers and provide clinical pearl information. These are all downloadable in our archive section for you through the Functional Medicine Clinical Rounds site. If you have any questions about any of our courses, our mastery courses through Integrative Medicine Academy, please check out our website at integrativemedicineacademy.com. You can also email to integrativemedicineacademy@gmail.com. Again, I'm Dr. Kurt Wohler for Integrative Medicine Academy. Thank you.